Title: Understanding Pneumothorax. Causes, Symptoms, Diagnosis, and Treatment. Ladies and gentlemen, esteemed colleagues, and aspiring medical professionals, I welcome you to today's lecture on the topic of pneumothorax. Pneumothorax, a condition characterized by the accumulation of air in the pleural space surrounding the lungs, is a significant medical concern that demands our attention. In the next few minutes, we will delve into its causes, symptoms, diagnostic methods, and treatment approaches. Causes of pneumothorax. Pneumothorax can arise from a variety of causes, with the most common being spontaneous, traumatic, or iatrogenic. Spontaneous pneumothorax occurs without any apparent trigger, often due to the rupture of a small air sac on the lung surface, called a bleb. Traumatic pneumothorax, on the other hand, results from external injuries that cause lung tissue damage. Lastly, iatrogenic pneumothorax stems from medical interventions, such as invasive procedures or mechanical ventilation. Symptoms and clinical presentation. The symptoms of pneumothorax can vary depending on its severity. Patients may experience sudden chest pain, often described as sharp or stabbing, which worsens during breathing or coughing. Shortness of breath and rapid breathing are also common symptoms as the affected lung's ability to expand becomes compromised. In severe cases, the affected side of the chest might appear visibly enlarged, and the patient could exhibit signs of respiratory distress. Diagnosis and imaging techniques. Diagnosing pneumothorax involves a combination of clinical evaluation and imaging techniques. Physical examination might reveal decreased breath sounds on the affected side of the chest. However, imaging plays a pivotal role in confirming the diagnosis. Chest X-rays are commonly employed as a preliminary step, revealing the presence of air in the pleural space and helping determine the extent of lung collapse. Additionally, ultrasound has emerged as an effective tool to visualize lung sliding, or lack thereof, indicating the presence of a pneumothorax. Treatment approaches. The treatment strategy for pneumothorax depends on its size, severity, and underlying causes. Small, uncomplicated pneumothoraces might resolve on their own without intervention. In more significant cases, medical professionals might choose to insert a small chest tube through the chest wall, allowing the trapped air to escape and enabling the lung to re-expand. This procedure is known as a thoracostomy or chest tube insertion. In severe cases or recurrent pneumothoraces, surgical intervention might be necessary to prevent recurrence.